You might think the way you sleep is harmless, just a matter of comfort and habit. But what if your favorite sleeping position was slowly compressing your spine, damaging your nerves, and even interfering with your internal organs? Because here's the hard truth, certain sleeping positions that feel cozy can actually disrupt blood flow, oxygen delivery, digestive function, and musculoskeletal alignment every single night. Over time, that adds up to more than just morning stiffness. It leads to chronic back pain, pinched nerves, poor circulation, acid reflux, and even premature spinal degeneration. Let's start with one of the most common and most problematic positions, sleeping on your stomach. It might feel natural to some, especially those who snore or sleep on soft beds, but stomach sleeping puts your neck in a twisted, rotated position for hours. This strains the cervical spine and can compress nerves that lead to numbness, tingling, or chronic headaches. Even worse, your spine is flattened unnaturally, losing its natural S-curve, which stresses your lumbar region and can lead to lower back pain and disc pressure. And that's just the spine. When you sleep on your stomach, you also compress your lungs and abdominal organs. The weight of your body against the mattress puts direct pressure on your heart, digestive system, and diaphragm, making it harder to breathe fully, digest properly, and regulate internal flow. Over time, this can lead to shallow breathing, sluggish digestion, and even poor lymphatic drainage. So why do people do it? Because in the short term, it reduces snoring and may relieve pressure on certain joints, but the long-term cost is high. Doctors often recommend transitioning away from stomach sleeping with pillows, wedges, or body cushions to gradually retrain the body. Now, what about fetal position? You might think curling up on your side is harmless, even comforting, and for many it is. But if you're curled too tightly, you're collapsing your chest, rounding your back, and compressing your diaphragm. This restricts lung capacity, reduces oxygen intake, and contributes to poor posture patterns that carry into your waking life. It can also compress your hip flexors, leading to tightness and reduced mobility over time. Side sleeping in general isn't bad. In fact, it's one of the better positions, but extreme curling can become problematic. Then there's the issue of asymmetry. Most people favor one side, either always sleeping on the right or left, and this long-term preference can cause the spine, shoulders, and hips to become unevenly compressed. For example, always sleeping on your right side has been linked to more episodes of acid reflux, as it places the stomach lower than the esophagus, encouraging stomach acid to flow upward. On the other hand, left side sleeping can improve digestion and lymph drainage, especially for those with GERD, but even then, only if the spine remains neutral. So what's the solution? Let's look at the deeper science of spinal alignment and internal pressure, and then explore the 5 specific positions to avoid. The position you sleep in isn't just a comfort issue, it's a structural one. Your spine, your diaphragm, your digestive tract, and even your circulatory system respond to gravity and compression every night for hours on end. Let's now break down the 5 specific sleeping positions that are doing hidden damage while you rest, and why your body often doesn't complain until years later. 1. Flat on your back, with no pillow under knees. Sleeping flat on your back may sound like the neutral position, and for some people, it's ideal. But without proper knee support, it can become a source of major strain. Why? Because your lower back arches unnaturally, creating a gap between your lumbar spine and the mattress. Over time, this increases tension in the hip flexors, compresses the lower back, and causes pain and stiffness when you wake. It also allows the tongue to fall backward, partially blocking the airway, which is bad news for snorers and those with sleep apnea. The fix: if you love sleeping on your back, place a small pillow under your knees to help maintain the natural curve of your spine and relieve pressure on your lower back. 2. Stomach sleeping with arms overhead. This is one of the worst postures for spinal health, and it's more common than you think. The neck is rotated sharply to the side. Both arms are elevated, sometimes under the pillow, and the lower spine is forced into unnatural extension. The result? Cervical nerve compression, shoulder impingement, numbness in hands and arms, chronic tension in the upper traps and neck. Over time, this posture can even contribute to thoracic outlet syndrome, a condition where blood vessels and nerves are compressed near the neck and shoulder. 3. Curled fetal position, chin tucked, knees to chest. This extreme version of the fetal position may feel cozy, but it leads to multiple problems. Spinal flexion compresses the discs and flattens the natural curves. Chest compression reduces lung expansion. Diaphragmatic restriction impairs deep breathing. Jaw clenching and forward head posture become more likely. The nervous system may interpret this posture as a stress signal, similar to a self-protective position during trauma, leading to restless sleep and tight muscles in the morning. To fix it, try a more elongated side-lying posture, keeping the spine straight and the legs slightly bent, not tightly curled. 4. Right side sleeping after large meals. While side sleeping can be beneficial, doing it on the right side, especially after eating, can encourage acid reflux. This happens because the stomach sits slightly lower than the esophagus on the right side, making it easier for stomach acid to rise, especially if the lower esophageal sphincter is weak. Reflux during sleep not only disrupts digestion, it damages the lining of the esophagus and leads to inflammation, coughing, and even increased risk of long-term gastrointestinal issues. Better choice. Sleep on your left side, especially if you've eaten late, as it supports digestion and reduces acid reflux episodes. 5. High pillow stacking for neck elevation. If you use multiple pillows to prop your head up, it might relieve snoring, but at a cost. This unnatural head angle causes forward head posture, strain on the cervical spine, tightness in neck muscles, and increased risk of headaches and poor spinal drainage. Long-term, this posture can contribute to neck arthritis and hinder the glymphatic system, the brain's natural detox system that works during sleep. Solution: use one supportive orthopedic pillow that keeps your neck in line with your spine, not above it. You may be thinking, but I've slept like this for years. And yes, the body adapts. It compensates. It tolerates until it doesn't. That lingering tightness in your lower back, the recurring neck aches, the sluggish digestion, or poor sleep quality, they might all trace back to how your body is positioned for 6 to 8 hours a night. But the fix is often simple. Small positional changes, consistent adjustments, and supportive props can completely reshape your sleep quality and your physical health. So what's the healthiest position to sleep in? Most experts agree. The best sleeping posture for spinal alignment and organ support is on your side, preferably the left, with a neutral spine, supported knees, and a slight bend at the hips. Here's how to build it. Use a firm, low-profile pillow to keep your neck in line with your spine. Not too high, not too flat. Place a small pillow or cushion between your knees to prevent your top leg from pulling your spine into rotation. This reduces stress on the hips, sacrum, and lower back. Keep your arms forward and relaxed, not tucked under your body or head, which can compress nerves. Lay on your left side to aid digestion, lymphatic drainage, and circulation, especially beneficial if you eat late or have GERD. Want to level it up even more? Consider using a body pillow for full spinal support and to help keep you from rolling onto your stomach or curling too tightly. Now, what happens when you shift to a healthier sleep position? Within a few weeks, many people report fewer morning aches and stiffness, improved digestion and less bloating, reduced acid reflux and coughing at night, deeper sleep with fewer interruptions, less tension in the shoulders, neck, and lower back, and it goes deeper than comfort. Your spine isn't just a stack of bones. It's a neural highway. When you align it properly during rest, you reduce inflammation, protect nerve roots, and allow your parasympathetic nervous system to fully engage. That means better cell repair, hormone regulation, immune support, and brain detoxification overnight. But if your spine is twisted, compressed, or your diaphragm is blocked night after night, the body can't do what it was designed to do while you sleep. So here's your takeaway. If you're a stomach sleeper, begin training with a body pillow to shift toward side or back sleeping. If you're curled in a tight fetal ball, try elongating your body and keeping your chest open. If you elevate your head too high, invest in a supportive cervical pillow that keeps your spine straight. And if you snore or have GERD, prioritize left side sleeping with a slightly elevated upper body. Sleep isn't just rest, it's therapy, if your posture allows it. Every night is an opportunity to heal or harm your spine, your organs, and your long-term vitality. So ask yourself, what position are you sleeping in? And is it helping you or silently hurting you? Because sometimes the most damaging habits are the ones you do while you're asleep.